Just wanted to take a quick second to discuss the differences between injecting testosterone subcutaneously as well as intramuscularly. Now, the pros and cons, let's go through it. The absorption speed for IM is faster. The absorption speed for subcutaneous is slower. This just means that the subcutaneous route can have a steadier release of your testosterone. Now, in consideration of your peak testosterone, when you actually are hitting its highest point, the IM is going to yield a faster peak. The subcutaneous is going to yield a lower peak. This usually means that with those high peaks, you're having a little bit more of those side effects. So with IM, you could possibly see a little bit more side effects as opposed to the subcutaneous route. Now, when we talk about as opposed to the trough, which means it goes like this for the peak, the trough is when you're at your lowest. The IM is going to have a lower trough and the subcutaneous is going to have a higher trough, which means that the subcutaneous reduces crashes. Now, the day-to-day variability, the IM is going to have a higher variability as opposed to the subcutaneous route that is going to have a lower variability of your testosterone levels. Subcutaneous will mimic your physiological rhythm a little bit better. Now, in comparison to your total testosterone and how it affects it, they are pretty similar to each other. But with your free testosterone, there are some higher peaks with the IM, but the subcutaneous has a little bit more of your steady free testosterone throughout the week. Now, when we talk about DHT conversion, which remember, testosterone converts into a bunch of things. DHT is one of those negative things that causes that acne, the hair loss in men, hair growth in women, the deeper voice, things like that. The IM route has a higher DHT conversion. The subcutaneous route has a slightly lower conversion rate. It's very peak driven. Now, when we talk about estradiol and how it gets impacted, IM, you're going to have some higher peaks. For subcutaneous, you're going to have some lower, steadier E2 levels, which usually has a better effect long-term with your estrogen if you have issues controlling it. Same thing when it comes to the estrogen symptoms. The subcutaneous tend to be a little bit less common, where the IM route seems to be a little bit more common. In consideration of your hematocrit, you'll see a higher rise in your hematocrit with the IM intramuscular version as opposed to the subcutaneous version of the injections. Subcutaneous is preferred if you're having a hematocrit issue, which is the thickness of your blood, the risk you are for clots, which will increase your risk for stroke, heart attack, pulmonary embolism, some deadly things. When we look at your PSA, which is your prostate-specific antigen, you can see a possible small increase in your PSA with a IM injection. Tends to be pretty similar, maybe a slightly less with the subcutaneous. Blood pressure related, the IM route can transiently increase your blood pressure, which kind of means comes and goes, whereas the subcutaneous can have you have a little bit more of a stable impact on your blood pressure. When we think about your lipid panel, because that's also affected with testosterone use. With the IM version, your lipid panel has a slight impact, whereas the subcutaneous route has a little bit of a less impact. When we think about your SHBG suppression, how much it's going to kind of lower that SHBG, which helps increase your free testosterone. The IM usually peaks the suppression of the SHBG a little bit more, so that's a good thing. Injection pain-wise, when we're talking about the IM, it's moderate, especially you have a few routes to take. You could do your deltoid, your glute, your vastus lateralis, your outer quad there. I would say that the glute is the easiestly tolerated and has the easiest kind of soreness afterwards, as opposed to the deltoid or the quad, which tends to have a little bit of soreness afterwards and could be a little bit more painful to actually inject. Subcutaneous injections, very minimal pain. And, overall, I would say if you have issues with high estrogen symptoms, high hematocrit, issues with your PSA, if you're just a complicated patient overall when it comes to lab work and safety, subcutaneous route tends to be the safer route to take. For some reason, people tend to lean on the intramuscular route over the subcutaneous route. So that's why I felt like it was important to decipher the difference between the two and kind of give you a little bit of pros and cons.